So listen, welcome. We're happy to have you guys on the webinar. And one of the things that's exciting for me is working with my two partners that are here. TJ, who's been part of our office for over almost 2 years, and has really been a leader as far as caregivers for our people. And then we have the most phenomenal nurse and extremely educated, two MBAs. Gosh, I just my little Bachelor of Arts degree looks pretty small next to her,
No.
but it's just a pleasure to have that kind of wisdom that we can grow in and see, and we just hope we can share with you. Part of what happens as people get older is a lot of times for doctors, medications are important, and they are, but we're just looking at the side where sometimes, a drink of water or a little extra sleep, those type of things can make a difference. And so as we do it, TJ's probably seen the most because he's done the most caregiving. But I know that Jasmine has seen it also in clinical areas for Sharp Hospital, teaching it at the school, and just having their wisdom come to it is really a pleasure. And I don't know if you have anything that sticks out, but I'll start with really it was my mom who we came in to visit, and she was flushed. She didn't look good. And we said, "Mom, what's up?" She says, "Oh, I need you to go get me a fish fillet at McDonald's." And I just started laughing because here you would think, oh gosh, she'd want some special medication or something. But for her, she was just missing it. Once we got it for her, she only took 2 bites, but it sure sharpened her and gave her a chance to refresh and regress. So I just, I'm sure you guys both have similar type of things. If you guys could share, that'd be awesome.
Awesome. Thank you, Mr. Dan. But before I continue, I'll allow my boss to talk. Miss Leah, please go ahead.
Okay. Hi. So for everyone, I have been in nursing for almost 20 years. I started back in 2008, and I love the topic of this webinar because yes, medication is important, but there are other things now that we could help provide our patients or help provide our clients in order to get them to that total well-being. And I've always promoted in the hospital, even if it's like a patient who's been in the hospital, or if it's a patient who's getting discharged soon, or even family members who are ill at home and who are on medications as well. It's always about addressing the total patient. So addressing their psychological needs, whatever health needs they need with medication, but addressing their total needs is what needs to be looked at in order to get them to being actively well. I remember when my mom was in the hospital and she was just asking my friend who I asked to go visit her. She said, "Can she get me some McDonald's?" You said McDonald's. Everybody loves McDonald's when they're sick, when it's not that great for you. But, she just wanted McDonald's. And I said, as long as it doesn't go against any of your orders, as long as you can eat, go ahead, go eat the McDonald's. Sometimes that's all you need. And then, once you get that whatever it is that you're asking for, that you feel like your body needs, then you're more compliant to whatever the plan of care is. And I've seen it with patients in the hospital, like, I just need a little bit more eggs or just a piece of toast or something when they have a restricted diet. It's finding that balance of addressing the total needs of the patient as a whole.
Oh, I like that, the whole part of the patient, because a lot of times we don't. We'll focus on the issue that they have at the time.
Right.
Yeah.
And I mean, sometimes it's just, like, I need to see my mom. So it was very hard during COVID when we couldn't have we couldn't have visitors in the hospital. Sometimes it just takes like that one visitor to help you feel better. So that's addressing your social needs. And sometimes, when you're transitioning to death, sometimes you'll have patients like hold on to their very last breath until they see that one family member that they really need to see. So, like I said, addressing the psychological, the social, needs of the patient for that total well-being.
Really
Well
is. I
said.
know, TJ, I know you've seen that as well, watching, and there's many caregivers and clients that you've had to work with over the years. What's your perspective on that?
Oh yeah. So once again, my name is Olatunji Taylor, and like you hear Mr. Dan says, for the sake of convenience, you can call me TJ. And through Mr. Dan's mentorship, I started a non-for-profit organization called Aricares Alliance. And my quote is that caregiving is not just a profession; it is a culture, a calling, and a shared human duty. And I believe that every act of care we give today is an investment in the dignity we will all um, will need, someday. And our mission actually is that, I mean, it's to empower families, caregivers, and home care agencies to provide safe, compassionate, and compliance care through education, guidance, and advocacy. And that is why this webinar is here today. And I'm really, I'm glad that Mr. Dan about some of the points that Mr. Dan made. And as a matter of fact, this morning about 7 a.m., I visited one of my, I will call her now. I call her my senior friend, but then I was on the care team of her husband, and she told me a lot of things that happened just before the husband passed. I was with him on Friday, and 2 days after, I received a text at church that he passed. But what I enjoyed about the work with that family was that the wife knew she totally understood her job as not just being the wife but the caregiver. She took perfect care of her husband. She was his advocate. Um, and she made sure that the medications were right on time. She was in charge of the meals. We went, she made sure that the medical appointments were done at the right time. And she paid close attention to everything. And something that baffled me just before he passed, maybe a couple of weeks before he passed, was that the man kept telling the wife that I want to travel. I mean, when are we gonna cross the border? There are too many people that wants to cross the border. When is it gonna be our turn? He kept telling me, but I didn't really figure out what he was saying, because I only spent like a couple of hours with him every day. But then the next day, the wife said, "TJ, I think I figured out what my husband has been saying. He wants to go, and that is why he's been talking about border. He wants to leave, you know, and that is why I feel that caregiving. I think it's so meaningful. Sometimes I feel it's a very holy job, and so I have it written somewhere here. It says caregiving is one of the quiet forces that holds the world together. It is woven in every family, every community, and every generation, and yet it is often unseen, carried out in it's carried out in whispered moments, tender gestures, and long nights that few will ever witness. But caregiving is more than a task. It is more than a duty. It is at its core a profound expression of love. So my journey into the world of caregiving was not a straight path. I've been in caregiving for more than 10 years, and of course, in addition to that, I also have my MBA. I worked in offshore on one of Chevron's platform in Nigeria. But then at some point, I felt, I mean, it's life is more than just working on the rig and talking to some mechanical parts. I could connect with the people I work with better than holding some set of spanners. So because of that, I decided to devote more time into caregiving and advocating. So I'm really glad to be here, and I'm sure that down the line we'll be able to share more insights to this topic, Mr. Dan.
Well, it's a great story because what it made me think about when you talked about kind of different things is when I look at medicine, we're born traditionally at a hospital, right? So that's where we start, and that's a lot of times where we end. And so, but in between, there's a lot of differences that happens in each way. I mean, seeing a friend in the hospital and then seeing a nurse come in and smile and go, "Hey, how are you this morning?" It's just you could see the difference in the soul, and you can see people smile. It's just an exceptional thing. What's your favorite part about nursing, Leah?
My favorite part is the different, being able to help people at their most vulnerable is my favorite part of nursing. So they wholeheartedly trust in you, and it's a profession that requires a lot of integrity because people are at their most vulnerable when they're relying on you for every little thing. And I've always held value to that.
Well, that's true, and that kind of goes in line with your speaking, TJ, where you're talking about how you wanted something that has a little more value in life than just go out and 9 to 5 work. You wanted to put heart and soul into it. I think that's really the real medication is when people come and give from themselves, from their heart. It makes a big difference, and people, and you can see it. It's great. So, I don't know how, because each one seems to be different. When we look at our caregivers, we got a whole list, and each one of them are very different. So we try to give everybody a heads up, no matter where they're going or what client they're with. We want them to be up to speed when they come in, um, because yeah, it's the person to person that makes the biggest difference. And I remember, Leo, because I was in the hospital with your mom there too, and she had McDonald's, and I go, "Where'd you get this?" She goes,
Yeah.
"Oh, I talked to my daughter, and she got me pancakes." I was like,
Yeah, that's all
"Okay,
she
if that's
wanted.
what you want, eat them up." It was so funny, but that's the kind of thing that each family goes through, and everybody that cycles through the path. I've had a couple different surgeries, but they were because I wanted to, and they made life better. So I'm not against medicine, but I can see the huge differences of just people to people, and things like handing somebody a glass of water when they're super thirsty. There's nothing better.
Absolutely. And that's why I always think people recover best at home also because, outside of, you could catch infection, like there's more infections that occur in the hospital, so it's just better to be at home, but people recover better at home because they have their loved ones there to help them or they're in an environment that they're used to. And so when I was at the hospital, I've always promoted, getting this person discharged as early as possible, pending that it's safe, pending that they're ready for discharge, staying at the hospital just so that you can have a nurse taking care of you versus going home and, maybe being a little bit more independent or relying on your family members or maybe getting a caregiver to help you out. That was always better than trying to stay one more night at the hospital because you can recuperate way better in a setting that you're familiar with and with family members or just in your own setting.
Mhm.
Yes, and I was about to ask that question actually. That Leah, what are you seeing in seniors, like real seniors, that shows us they need people as much as they need prescriptions?
Yeah. See, I
Yeah.
mean, as far as seniors, the patients that I've dealt with, there's always side effects to medications, and so there are certain medications that, of course, you have to give because they need it in order for them to be better. But really minimizing the medications that a person is on is should be a big priority. And then, like I said, people tend to be more confused in settings where they're not familiar. So if you're in a hospital, you wake up in the middle of the night. If you're elderly, that's when you tend to be more confused. So really helping these patients to get better enough so that they can get even better at home is best. So getting people discharged and you know discharged to home is best for their health. Because like I said, that familiar setting will help with it. It'll help decrease confusion in the elderly. And having that familiar faces and familiar setting will just make you feel better, like your total wellness.
Right. So it means that um so the checking in, the presence, the conversation with family actually um has a positive impact
Yeah.
on the seniors, overall well-being. So it means that regular interaction can actually reduce, maybe depression, the
Mhm.
anxiety. I know sometimes ago, I mean, before I started, before I had the opportunity to work in the hospital, sometimes when I went to visit some people, the way there's a way the hospital smells. I wouldn't say smell, but it's I think what's come. I mean, the odor. It's kind of interesting. You can easily tell that you're in the hospital than from your home. So being in the hospital sometimes gives me the anxiety. I remember when my wife was she went in for a surgery last October. You know, it's I mean I knew I was very sure that we were going to get the best care, but seeing other folks, hearing all the announcements, all the code reds and everything, kind of increased even my anxiety. So I wonder how my wife would have felt if I was feeling that way. So I totally believe that familiar faces reduces confusion and agitation, especially for those with memory issues like dementia. And I want to ask that from your I'm sure you'll be able to share some example with us, of course, without names, of a particular maybe senior you've seen where human connection made a bigger difference than changing their medication.
Oh, yeah, for sure. We saw it a lot in, especially like people who would come into the hospital for elective surgeries and then they'd be on pain medication. So
Mm.
providing alternatives instead of pain medication helps to decrease confusion, especially at night, especially if they've had anesthesia, and especially if they're elderly. It helps to decrease confusion. So, you know, um, yes, offering pain medication to a patient, but also using alternatives such as ice or just keeping that patient company will help to, decrease their need for pain medication, because sometimes just providing that so that they're not always thinking about when the next pain medication is due. So just helping provide that little bit of distraction with keeping that patient company um, goes a long way.
Oh yeah. And as a matter of fact, I learned this caregiving in a very interesting way. Maybe I started, maybe it's because I started with my aunt. It's kind of made caregiving make a lot of sense to me. And of course, you're right. I have a lot of examples, and I could go on and on and on. I remember a time with one of my clients. She was quite old. She was at the time she was 94 years old, and she was alone. She was very cognitive. She was alert, and at some point the family said they decided to move her out of the house. They decided to move her to a facility. And trust me, from the day they told her, she went down. Like she started, going down. I mean, down and health wise. So what I did was that, well, and this is not to spite other caregivers. Many of the some other folks that So and this is what I want to say right quickly, that caregiving, if you have to be a caregiver, it has to come from your heart. You cannot be a caregiver just because you want some money or you want to be able to pay some bills. It really has to come from your heart. So, well, some of my friends were, a bit of unhappy, but not their fault, but because they knew that you were going to get out of jobs, so they kind of relaxed. But what I learned was that I decided to move closer to her. I sat with her continuously. Every time I went there, I would sit with her. We would talk. I mean, I'm not a fan of football. She was a fan of football. But then, just to make her happy, you know, I I will laugh at every moment, every funny moment, laugh at all the maybe not funny jokes. And I discovered that maybe a few days just before she went to the facility, she forgot about, you know, she stopped complaining. And all she could ask was, TJ, would you be on my team? I want you to be there. So she forgot about medication. She forgot about the house. She forgot about what her kids did to her. She forgot about a POA, the power of attorney. She forgot about that. And all she wanted was, TJ, I want you to be on my team. And she said the same thing to like a couple of other caregivers. So I totally agree with you that it is not just all about medication. Yes, we have to give the prescription, I mean, the prescribed medication, but beyond that, the human feeling, the human part of caregiving has to be shown. Mr. Dan, what do you think?
No, absolutely. That's kind of why we're in the industry, watching family go through it. And it's different when you're young and you go to the hospital and something happens and boom, you're back in action in a month or two. When you get into your senior's age, it lasts a lot longer. And so a lot of times it can be months and months that somebody's needing extra care and medication. And that's why we're here as an agency to help out and give people a chance to get away and feel good. But we really appreciate the knowledge of the other parts of the industry that go deeper than we do. So
Yeah,
having
so
you here to speak about medications, to have you um, share some of your caregiver experience, it's valuable, and we appreciate that very much.
right. So we often hear about loneliness in seniors, and I already gave an example of that. Um, I know that loneliness can look sometimes. I feel that loneliness can look like increased confusion. Like it can look like crying or irritability. Sometimes it looks like the patient is refusing care or food just because they're lonely. And I also know that emotional distress can well, don't let me say I know. I feel, let me put it that way, that emotional distress can worsen blood pressure. um it can increase the senior's perception of pain. It can also affect sleep quality. So Leah, from your experience, h- how does loneliness show up in ways that look like it is a medication problem, if you know what I mean? So because sometimes people confuse loneliness with the need, you know to offer some medication to a particular person. So how does it what ways does it show up, and how can we counter this? How are we able to separate the need for companionship from medication?
Yeah, years ago, we've always been trained, a patient is calling and it's always like offer pain medication, or they need some sleep, offer sleep medication. And sometimes when they're calling a lot, like you said, it is that loneliness versus actually needing medication. And again, I advocate for discharging that patient early, because nowadays the hospitals are full. Oftentimes we work understaffed, and so a lot of the times our support staff don't have the ability to spend that quality time that, say, a caregiver at home would be able to spend with a patient at bedside. We do our quick checks, like, hey, are you doing okay? Oh, you don't need anything? Okay. If you need anything, give me a call. Sometimes it's so quick as that. But, a lot of the times when we're dealing with loneliness, they just need that companionship. And those are things where, like I said, you can get a lot better when you're at home versus being in the hospital. And you also don't want to promote like over medicating a person and overlooking that all they need is companionship, or all they need is, they're calling on the call light a lot, not because they're confused, it's because they just want someone in their room checking on them. It's always that, hey, are you doing okay? Hey, can I get you anything? So sometimes it's just that person that they're looking for, not necessarily a thing that needs to be done that they're looking for. It's just that companionship that they're looking for. I see it a lot at night, especially when I work night shift, because a lot of the confusion will set in at night, but a lot of the loneliness will set in at night also, because everything is a lot quieter at night. Um,
Mhm.
and so I saw it a lot at night. But nowadays, they train nurses, like I said in the beginning of the webinar, they train nurses to look at the patient, the total patient, instead of just addressing their medical needs. And Sharp has always had this tagline where it's like the science of medicine, but the art of caring. And the
Mm.
whole time that I work, and even now as a nurse, like I truly believe in that tagline, because it really is a science, but at the same time, it's the art of really being able to care for that person to get them to that total well-being.
Right, right, and of course, I've seen differences between seniors who go home to good
Hmm.
support and those who don't.
Hmm.
Because I noticed that um, those with support are less likely to bounce back to hospital quickly. You know, they have better medication adherence, and they are in a better mood, and they function well. Um, I know that those without sometimes they stand a risk or higher risk of complications, let's falls, readmissions, maybe family crisis instead of care. Because believe it or not, when families have to take care of their loved ones, at their later stage, um, it's really difficult. Sometimes I remember Dan telling me some times ago that his brother, sometimes when they were taking care of that, I think was it that dad, his brother offered to take care of, was it dad or mom?
Mom,
Was it mom or dad?
it was
Yeah,
mom.
it
Yeah.
was mom. So he offered to take care of mom, but then it became tired. It became warm in no time, because it took him about 10 minutes to take her to the bathroom. It took him about 10 minutes to help her sit and to locate the toilet seat. And it also took him another 10 minutes to take her back to the room. So that is 30 minutes of his sleep gone. So imagine that happening 3 times.
Right.
But then, so that can actually cause some tension, among siblings and family members, but if we, and that's the crisis I was talking about. But then if family members are able to support the senior or whoever needs that care as much as they can, if the support is coordinated, it's it's really gonna help this whoever needed that care, or the senior, to recuperate or to get well faster. And Leah, we're clearly not saying medication isn't important, right? But then, um, as a professional, right, I want to ask you, or how do you talk to families about balancing medication with human support? How do you advise them?
The biggest thing I think is education. Um, finding a good balance, because you also have to listen to the family member, because the family member will have big and important input on what is good for their family member. So you have
Mhm.
to, as a caregiver and as a clinician, you have to be willing to listen to the family member, because they know that family member. They know what they like, they know what they love. Excuse me.
Sorry.
They know what's gonna help get them better. And then your side as a clinician is to educate them, in finding that balance of medicine and um, psychological and social, and addressing psychological and social needs.
Yeah. So now I'm curious. What are some what are some red flags that families should bring up? You know, to a doctor or a nurse where you'd say, okay, it's time to review these medications. And, you know, you may also want to seize the opportunity to ask them that, okay, what kind of support are they getting? So I really want you to be able to, I want you to kind of, help us, separate or to streamline this process. So if I was going to come to you about, my observations and, about my family or my dad, take for instance, and at what point would you decide to say, you know what, it is time to review this medication?
Sorry, repeat that question again.
Yeah, so I was saying that as much as we are encouraging family members, to make sure that they give their loved ones, that human support. We don't want to discourage them from, bringing up issues or some observations. So that was what I was asking, that what are the red flags that families should bring up with a doctor or a nurse, where you as a professional would say, okay, it is time to review these medications.
Yeah, it would be increased confusion or any other like adverse side effects that you're not expecting. So if there's any change in status in the patient, of course you're going to want to bring those up to the physician. But as far as like reviewing a specific medication that they've been on for years, it's really any changes in the status of
Mm,
the patient.
right. Because many families actually feel, intimidated in the medical settings. um they don't know exactly when to talk. Sometimes they don't know how to, respectfully advocate for a more human-centered approach when they talk to the doctors and nurses. So I agree with you. I mean, and I feel that if we could, you know kind of spread the news, encourage everyone, to bring their observations. I mean, every day they observe everything just before the appointments. They should write those observations down. You know, I think that will be helpful. And just before we, some questions are coming in, and so for everyone in attendance, please, we encourage you to just drop your questions. If you look at the top right hand of your screen, you will see a question, a Q&A icon. Just go in there and drop your question. um Ms. Leah, a lot of families watching this might feel overwhelmed. They're doing the best they can, but they still feel like it's never enough. um so if they want to bring more of this human side into their loved ones, care, what are, one or two simple places to start? I think this question should be to Mr. Dan, not to Ms. Leah. So, Mr. Dan, do you want to attempt that?
Well, I think the biggest thing we can do is just look at variances. So if
Yeah.
they're not sleeping, or if they're getting angry, or they won't eat, a lot of times what we'll do is we'll just talk to them a little bit. And because to call a doctor and say, hey, change this medication, well, he may need to do some testing, or she may need to do testing so that they can get the right level. So really, we try to just stay in our lane and do the best we can, and let love and caring be a part of it, but also keep our eyes open, because sometimes we don't get to see the red flags go up. We got to say, okay, she's sleeping more, or she's not sleeping. That's probably the most. They get up in the middle of the night and they don't really even realize they're up, but they're
Mm,
moving. I think in hospitals they have the same thing. I'm sure people will get up and walk out of their room and start going down the hallway, and they're going home, but they're not discharged. They're just in their mind. That's where they want to be. So
yeah,
Similar
right.
to how we worked in the hospital, we always said, the physicians should really listen to the nurses, because the nurses are at bedside for 12 hours a day. Like each nurse is going to be by that patient and they know what's going on with the patient. So similar to that, when the patient goes home, we as the caregiver should really listen to the family members, as because what their input is valuable, because they
Mhm.
know that patient when they were well, and then they see the changes in that patient or in that client. So really putting value to whatever suggestion or whatever input they're giving you, and you know, and and even just to like, oh, that my mom likes water at this time, or my mom likes to walk this many times, or especially during the day, and just really holding value to that type of input, um, will go a long way as far as caregiving for that client.
Oh
Yeah,
yeah.
I think that wisdom is the same for caregivers. Or, they when they come around the room, they should check and, see what's there first before trying to make changes.
Hmm.
All right. And family caregivers or professional caregivers, I would say, should pay close attention to their loved ones or to their clients. Um, because my training tells me that falling has nothing to do with age. It has to do with some medical problems, some health issues. So if the falls, is more frequent, if they aren't eating, drinking, bathing well, without help, if they're more confused, if they're wandering, if exhibiting unsafe behaviors, you know, they have to talk to then they know they need more care. Maybe then I think at that point, it's good to talk to the nurse or to the doctor, but then at that time they need more support services. To be able to help, especially for family caregivers. They might be so exhausted. Maybe at that time they need some, support services or respite care. So, and before we move into the questions, I have about 5 questions here. I hope we're able to touch on everything. Um, I would say directly to family caregivers who are watching and who may be watching later, who may feel tired, guilty, or unsure of, if they are doing enough. From me to you, you have to always affirm
Right.
that the work you're doing is sacred. It is meaningful. You know, Perfection is impossible, but trust me, your presence is powerful. Asking for help is not a failure. So if you call on elite home care for help, for some respite services, or if you call on Aricares Alliance, for some materials, it is wisdom. It is not failure. Small, consistent acts of care matter more than big and rare gestures. Like I said, the last time my wife was in the hospital, at some point, the nurse called and said, "CJ, I need to know um, a little bit about your wife. Does she sleep this long? Is she a good sleeper?" Because after a surgery, she was supposed to wake up about, let's say, an hour and a half after. But my wife slept for 3.5 hours, and they were really worried. But my presence and the information I was able to give them, and I was the only person that was able to get her to wake up, because she knew exactly, she could smell me, she understood, she heard my voice,
Your
she
voice.
yeah, so I knew exactly what to tell her. And after 3.5 hours, she was able to faintly open her eyes. And so that is the importance of presence. So don't give up, just keep supporting. So there's a question here, Leah. It says, how do I know when my aging parent needs more hands-on support at home instead of just adjusting their medications? I'm sure we have answered that question along the line, but if you can just quickly, you know, give one or two sentences on that.
Well, I mean, patient safety is always most important. So if if they're having trouble keeping the patient safe, so if the patient require more eyes on him or her, then of course you're going to need more help. And you don't necessarily look at medication right away in order to keep a patient safe. It's surroundings, it's the type of you know uh bedside support that you can give for that patient. It's not always about medication. So just trying to keep the patient safe should be first and foremost. And if that requires two instead of just one caregiver because the patient's a little bit more confused or maybe combative at times, then definitely just trying to keep the patient safe or the client safe should be first and foremost.
So I have a question. So about some clients or so they get agitated sometimes, they get confused. Um, and of course, I've worked in a hospital settings where sometimes they would administer aromatherapy. So and this is my question that are we know that care, I mean, as far as California is concerned, caregiving is non-medical. But aromatherapy, is it allowed? Are caregivers
So
allowed?
there are certain conditions that will have adverse reactions if they react to certain like aromatherapies. So you just have to make sure that like that client's heart condition won't have a reaction to aromatherapies. But I mean, there are other things like, you know, just providing like a quiet space, or like music therapy, pet therapy, art therapy. There are so many other things instead of just aromatherapy. There are so many other alternatives that you can help provide to address that that part of the patient that addresses their like psychological needs. Even like just taking them outside and having sun, and you know, for that patient, if it allows that patient to be outside, you know, that that will address their needs. But with aromatherapies, you do just have to watch, because there are certain heart conditions that will react to the whatever like therapies that you're trying, like lavender or something, like the oils that you use for essential oils.
Oh, right. Thanks for clarifying that.
I never thought
So
of that's
yeah,
good. Hmm.
yeah. So I know you have answered. So this question says, my loved one has dementia and often gets agitated in the evenings. Are there simple non-medication way things we can do at home to help calm and reassure them? I think you've kind of touched base on that already. Is there anything we are missing here as far as dementia care is concerned? Mr. Dan?
And
Oh, sorry. Please go ahead.
Oh no,
go ahead. Go ahead. I mean, as far as like, you know, providing like a quiet setting, instead of, you know, really de-escalating the mood, instead of, you know, getting that patient even
yeah.
more hyped up because they're already confused. Really like providing like a quieter environment, maybe like I said, music will help calm the patient, you know, other therapies to help relax the patient, instead of just looking at like medication alternatives. Even like providing like tea could help a patient, just help them relax.
Hmm.
But again, with teas, you have to watch out any like heart condition. So with every other like alternatives that you provide to a patient, you just have to make sure that it doesn't have like an adverse reaction to whatever medication they're on, or whatever illness they actually have already.
Right. Right. And yeah, before I ask the last question, I want to announce to everyone that on this webinar is Mr. Dan is the owner of Elite Home Care. And by home care, I mean they provide caregivers that support trained caregivers actually in compliance with California Department of Social Services and curriculum. They're all trained. They know how to best match their caregivers, you know, with your loved ones. So if you need full caregiving support, or if you need partial or 24/7 or respite care, please talk to Mr. Dan. And of course, if you want to get more information from them, it's their email is info@elitehomecare.com. And the best number you can call on is 858-232-8457. I'm going to share this in the chat room, and of course, I'm going to send it to us to everyone after the webinar. And of course, if you want some materials, if you want to know more about caring for your loved ones and some other information that has to do with caregiving, reach out to Aricares Alliance. We'll be able to help you out. Lastly, a family caregiver said, "I'm exhausted and feel guilty that I can't do more." And I think, Mr. Dan, this question is to you. Maybe later, Ms. Leah can, respond to this. So it says, "I'm exhausted and feel guilty that I can't do more. How do I balance taking care of myself while still giving my loved one the emotional support they need?"
Well, I think it's just realizing how far you can go. Because people think of, oh, I'll take care of family like it's going to be easier than if it's in a, if you have help. I mean, it's just the biggest part of it. And I think until people get exhausted, they don't realize that. And
Mm,
then now they're 2 days behind, or they're missing work, or they're starting to get angry at the person who has a dementia, or who doesn't feel good, or who can't get out of bed. So I just think in the self-awareness is probably the biggest thing. But I'm sure Leah's seen more of that. And you want to tell them a little bit about your school or that type of thing? And because as people, the more education they get, and the more experience, the better they can be in the industry.
mm,
Um, yeah, for sure. But also, I wanted to touch in whatever it was that you were saying, Dan, just having that self awareness. And also, in order to be really successful and having your loved one recover or get them to the best health that they can be, you really have to know to reach out for help, because you really can't do it by yourself.
mhm.
Just with Elite helping out with providing with respite care, or even providing care for part of the hour so that you could be the best version of yourself to help care for your loved one, because you feel rested. That you have to reach out for help, because that's the reason why you need extra help, is because your loved one is not feeling 100%. And that's why it is going to be more difficult to help your loved one get to that 100% or be the best that they can be. But you really can't do it alone in order to be successful, to have your family recover it at home. You really have to reach out for help. And that's why companies like Elite Home Care will exist. And that's why they've trained their their employees to match, or to know the needs of the client, because you absolutely cannot do it you cannot do it alone, because everyone will need help when it comes to taking care of a loved one at home when they're not 100%.
Right. And I have an excerpt from my book. The title is The Unexpected Teacher. So it says, "Caregiving teaches us things we never learned in school. How to grieve someone who is still alive, how to celebrate victories that others may never notice, how to fight for someone's dignity when the system fails them, how to love through exhaustion, frustration, and uncertainty, how to hold hope and reality in the same hand." So it reveals for caregivers, it reveals our limitation, but it also reveals our strength. It exposes the fragility of life, yet deepens our reverence for it. It confronts us with loss, yet invites us towards unconditional love. And perhaps most unexpectedly, caregiving teaches us about ourselves, the parts we didn't know we're brave, patient, compassionate, or resilient. So, um, and for me, I just wish that everyone understood, especially the family caregivers understood that you know it is important that as much as they give their all and their love to the person they're taking care of, they have to take care of themselves. Whoever their loved one is as strong as they are. If the caregiver becomes fragile, then the loved ones becomes fragile too. So I encourage I encourage you, yeah, look into yourself, be strong, and then ask for help. Know exactly when to ask for help. um and
and
before
and we live in a society right now where we see asking for help as a weakness, when it should be
Mhm.
seen as asking for help is a sign of strength.
Right, I agree. So yeah, Dan, thank you both for for your expertise, and for putting your heart into this conversation. So what I'm taking away is that medication has its place, right? But then it cannot replace human beings. Our presence, our attention, our daily support. It cannot. So that would be my final call, Mr. Dan. What's your final call on
Well,
this?
I think you hit that nail on the head. I really do. I mean, it is each one sometimes seems to take over the other, but the reality is together it's twice as strong.
Mm-hmm.
I agree, TJ. That was beautifully put. And imagine nowadays with AI and robots, imagine them taking over what we as caregivers or we as clinicians would be doing as far as like caring for the total patient. You can't imagine that because no one can replace that human side of care.
Mhm.
Right. So our hope today is, to advocate for a balanced approach to senior care,
Yep.
one that values human interaction, emotional support, and personalized caregiving as essential parts of wellness. So we encourage you to look at your loved ones, look at your routine and ask, where could more connection help? Reach out for support if you're carrying this alone, please. I was heartbroken about a week ago when I spoke to one of my senior friends, and she told me expressly that she actually regret that she did not ask for help. Her friends, when her husband died, her friends kept asking her, "Why didn't you ask for help? You shouldn't have done this alone." So that was a major regret on our part. So please, on behalf of Aricares Alliance, Alien Home Care, and our professor, Leah, thank you so much for carrying enough to be a part of this conversation. Um, I hope you've learned one or two from this webinar, and we hope to see you again in the next one. Um, Thank you again, Mr. Dan, Leah.
Thank you,
Thank
TJ.
you. Thank you.